Over a year into pandemic, many patients who had a long recovery from COVID-19 have been stuck in a limbo with little to no support and care. In Ontario, the lack of a long COVID strategy has caused fragmented clinics that are at risk of closure. With up to 1.4 million Canadians living with long COVID, and with effects on both the healthcare sector and the overall economy, the need for a coordinated approach to care for long COVID patients is essential. The Internal Ministry of Health documents are of little help, citing only that other provinces are national leaders in PCC care and not shedding light on what Ontario is doing to develop a long COVID strategy. The documents instead highlighted a Freedom of Information request and a 34-page record which was withheld in its entirety due to cabinet deliberations. Despite being denied a deep look into the internal documents, we can look to other sources for an understanding of long COVID. Researchers estimate about 10 to 20% of those who had COVID-19 will still have lingering symptoms 12 weeks or more post-infection. These symptoms can range from brain fog, fatigue, anxiety, loss of taste and smell, to other so-called long hauler symptoms. These effects not only affect the health of patients, but up to 70% of those living with long COVID may have to take time off work, putting further strain on our economy. With the current and likely rising volume of patients, an anticipated increase in emergency room visits due to long COVID, and the need to have an equitable provision of resources and support, there is an urgent need for a provincial-wide long COVID strategy in Ontario. Without any dedicated funding, the fragmented clinics set up around Ontario are sure to close in the near future. This can be seen in Windsor, Ontario, where only a few months ago, the medical facility Hotel du Grace Healthcare set up a long COVID clinic and has since been forced to close it due to inadequate funding and resources. The provincial government has implemented a fee code for doctors to use when assessing and managing patients, but this clearly isn't enough to coordinate care in a meaningful way. Furthermore, similar centers in provinces such as Alberta and Quebec have forged ahead of Ontario and are considered national leaders. While the unknown nature of long COVID requires caution when setting up a provincial strategy, the research and best clinical evidence must be taken into account to ensure consistency in care when attending to those living with long COVID. The preliminary conversation between the medical facility and the Ministry of Health has not been fruitful, and more needs to be done. It is essential to provide those living with long COVID the essential treatment and care they need. Having standardized diagnostic assessments, referral criteria, and educational resources could improve the quality of life of many Canadians suffering from long COVID and will have a positive trickle-down effect throughout the country. As the need for a provincial strategy becomes more and more pressing, it is time for the Ministry of Health and the provincial government to establish and fund a long COVID strategy in Ontario.